Welcome back and welcome to Focus on Health Law. This will be proudly presented here by an internationally renowned healthcare attorney by the name of Kenneth Haber. Attorney Haber's headquarters is located in Bowie, Maryland. As usual, our moderator is Attorney Ramesh Khurana from the Khurana Law Firm. Attorney Khurana has a bucket full of legal questions for Attorney Haber regarding pain management patients and appropriate contracts. Let's take a closer look.
My name is Ramesh Khurana, attorney at law. I have my legal practice in Gaithersburg, and we have today a very distinguished and honored guest, Kenneth Haber, attorney at law, who is not very far from my office, maybe 15-minute drive. His office is in Boyers, Maryland, but more or less he practices nationwide, because in case it is required, he can coordinate with the local lawyers. And he is a healthcare attorney, very renowned healthcare attorney. So, welcome, Ken.
Thank you. Thank you, Ramesh.
Ken, it's always a great pleasure having you in our studios.
My pleasure.
So, today I'm going to ask you questions about pain management patients and appropriate contracts. So, you take care of the contracts for the physicians.
Yes.
And any issues arising out of the contracts.
Yes.
Yeah. Okay. So, can you please explain to us what is a pain management and other medically necessary controlled substances contract?
Yes.
Please elucidate this point.
It would be my pleasure.
Sure.
Pain management contract or any sort of other narcotic patient who needs narcotics of any sort for pain or other conditions, there really needs to be a contract between the doctor and the patient, outlining and defining the responsibilities of the doctor, the authority of the doctor, and the responsibilities of the patient. And I mean responsibilities of the patient because these are very addictive substances. And what's happening now in our society is we actually literally have an epidemic of opioids. And many people start because they do have legitimate pains. And one of the things that people don't understand is the connection between the pain medicine the doctor gives them and the addiction that comes from it. Let's just assume you have some severe pain and the doctor legitimately wants to give you some pain medicine to take away that pain. That very medicine can become addictive because it loses its effectiveness in
over a period of time.
Over a period of time,
Right.
it loses its effectiveness in mitigating the pain, and the doctor has to increase the dosage to give the same benefits of mitigating the pain. And it becomes a spiral up and up and up unless there's interventions that can otherwise deal with the pain, such as physical therapy or other type of interventions that they have. And it just should not be taken, like candy. I got a pain, I'm going to get rid of it.
That's a very good example. I like it.
Yeah.
So you have to stop at some intervals so that you don't become addicted to it.
You have to change things around, different medicines or whatever, but the most important is in the very beginning, the doctor needs to have a thorough discussion with the patient, defining the patient's responsibility and the doctor's responsibility. And that.
So there should be a meeting of minds before the doctor gives this medication to the patient.
That's right. And that's when it's a legitimate patient.
Right.
And you can have patients that are already addicted and they'll come in and they'll lie their heads off.
Right.
They'll lie their heads off because they're addicted and they will say or do anything in order to get their medicine.
Right.
And they will lie to the doctor. They may be doctor shopping. They can go to 2-3 doctors and get
Does it happen
medicines.
quite often?
It happens extremely often when you're dealing with addicted patients, when you have patients that don't have proper pain management contracts and are not properly regulated by their doctors. The doctor's responsibility, as best as possible, is to make sure the patient has limits placed upon him. And that's what the pain management contract's all about.
So that is the
limits.
expectation by the attending physician from the patient.
That's correct.
And that should be outlined in the contract between the physician and the patient.
Absolutely.
So tell me, Ken, who prepares this contract?
Well, the doctor is not an attorney, so an attorney will presumably prepare such a contract. Like we have that type of contract available for
So
our
some kind
physicians.
of standard contract is prepared
Yes.
by an attorney on behalf of that particular practice, and then that doctor probably will tailor it as per needs of the patient.
As for the needs of the practice.
So do you think that most of the physicians who are making certain legal changes in the contracts, which are of course pre-prepared and probably they are filling in some blanks, right?
Hopefully they're not.
They are not preparing the contracts, right?
They're not attorneys, and they should
Right,
not
that's why
pretend to be attorneys.
And moreover, how much time they have got to prepare the contract?
Well, the contract, if it's already pre-prepared,
Pre-prepared.
it'll be there for them and the patient to execute, and it'll have standard provisions in it that define the relationship, such as the patient at any time can be called by the doctor to come in and pee in a cup. The patient can be told to come in and bring your pills in so that we can do a pill count. There's various things that the patient has to be willing to agree to. The patient should have to be willing to go to one pharmacy, and the patient should be willing to waive doctor-patient privilege between the pharmacy and the doctor and the patient, so that the pharmacist will talk to the doctor, which is a normal thing, but having it in writing is very important, so the patient knows that this is going on, and the doctor knows which the pharmacy is. And if the patient goes to a different pharmacy and the doctor finds out he is within his rights under the contract, cut the patient off, period. Because the patient's breaking that contract that is there to not only protect the doctor, but to help enforce the patient, with the patient, his responsibilities. So he won't go doctor shopping, and he's agreeing to have just this one doctor treat him as far as any sort of controlled substances. So he can't go doctor shopping, and if he finds out there's other doctors treating this patient, boom, that's the end of the relationship.
Let me ask you a related question when we are talking about the contract. So the doctor or the practice, they hired a healthcare attorney like you to prepare a contract, and subsequently when they are explaining all the terms to the patient, or they are preparing the blanks and presenting that contract to the patient, are they required to caution the patient that this contract of course is enforceable, and would they advise them, if you want to show it to your lawyer, you feel free to show it to your lawyer?
The patient? Yeah, of course. And the contract will also say that a patient is found to be selling his prescriptions, that the doctor can notify the police. Because the patient can't be doing this type of thing. And the patient not only needs to know the doctor can do it, and the doctor not only needs to be able to do it, the patient needs to know for his own benefit that there's limitations he has to honor. And if he doesn't honor those limitations, there are consequences.
Okay, then let me ask you one more question, Ken. Now, what is the pain management and other medically necessary controlled substances or contract necessary? How do you define this concept?
Because of the fact that when you have addicted patients, they will lie, they will cheat, they will sell their own children for the next fix. And that's why it's so important to have a proper contract, because you cannot trust the patient if he's addicted.
Right.
And you as a doctor need to try to give him as much support to help him from getting addicted, including the knowledge that if he gets addicted and he starts playing these games, he's going to be caught, and he's going to not only lose the doctor, but he's also going to possibly be reported to the authorities. And these patients, when they are addicted, they become very, very manipulative. And they will try to threaten the doctor. They will try to entice the doctor with sexual entrees. They'll try to do anything they can do.
Whatever could entice the physician.
Whatever
basically,
can encourage
just to make the physician agree.
to give him the
Right.
medication that
Right.
is not appropriate.
Okay, let's stay with the contract, Ken. So when we are talking about presenting a contract by the physician to the patient, of course, the basic term of the contract is, then of course, one thing is there should be meeting of mind, and second thing is person should be of sound mind, right? So that he has the kind of discretion to make a rational decision. So if the person is already addicted, so probably doctor is not going to present a contract to him.
Well, if the patient's addicted, unless the doctor is an addictionologist who is there
There you
to
go.
treat him for addiction,
Uh-huh.
you know, and then they won't be giving him those medications for pain. There are certain drugs that are out there for getting patients off of drugs, and those are other types. But they can become addictive too. So the doctor has to be very careful. It's just a very hazardous area to be, and yet it's a legitimate, very legitimate, necessary area to be for the normal physician in terms of he has a normal practice, and once in a while, sometime, that particular patient is going to be in pain.
Okay.
And the doctor needs to deal with that legitimate pain. And he needs to be able to deal with trying to eliminate that pain other than through drugs as well. And that the drug should be a temporary stop gap, and that they should try to get therapy in there. They could try to do a stent device, which is electronic shock type of mild shock that can possibly help at times with the patient's pain. And there's various things that you can do. Now, one of the things that we recommend to doctors, that if they've got somebody who has chronic pain, that whatever their regime is for treating this patient, that it goes for a second opinion at a major medical establishment like a university's medical center, and get their approval for it. And the reason for that is if they present it to the medical center, the university's medical center, and they approve it, then it becomes difficult for the doctor to be prosecuted.
Right.
And the patient has to be willing to go and have a second opinion and make full disclosure to the medical center so that there can be a second opinion for that doctor. And if the doctor doesn't have that, he's playing with fire.
So probably that will be part of the contract,
That's
right?
part of the contract.
Wonderful, wonderful. Now, can you please explain what are the provisions under which or conditions under which doctor will be basically prescribing these kinds of pain management medicines?
Well, some of them that we mentioned is that the patient is willing to come in for a pill count. Because sometimes these people, they sell their pills. And you don't want a patient who's selling their pills. Sometimes they take double the amount of pills in the beginning, they go to a different doctor for the second part of the month. And they'll get the dosage there for the second half of the month, and you don't want that to go on. So the patient has to come in, and he better have, if it's a 30-day supply, he better have 15 days or 10 days, 20 days of pills if you come call him in on the 10th day. So where's your 20 days of pills? So you don't have them? I'm cutting you off.
Right.
I don't want to hear that you lost them, that the cat took them, and or any other excuse that you might have. So you have to have these type of things.
So it's a
in
very
there.
challenging position for a physician to
Yes.
handle this kind of patient.
It is
right?
because if they are addicted, they will be manipulative, they will be lying,
Right.
and you don't want them
Right.
if they are addicted, unless they acknowledge their addiction and are working to get off of the addiction. But then you don't want them if you're a regular family practice doctor, because of the fact that that's a totally different type of situation. They should be
Right.
with an addictionologist who specializes in getting the patient
Right.
off of addiction.
Right. Now, Ken, we are just left with 1 minute, as the cameraman is indicating. Now, just to answer this question quickly, how do honest doctors get involved with the licensing boards or DEA and our prosecutors concerning controlled substances?
Well, because they don't have these type of contracts, and the patients abuse the drugs, the patient can get caught selling the drugs, and then, oh, Dr. So-and-so gave me these drugs. And there's the vial with the drugs in them with Dr. So-and-so's name on it. And you don't have the contract, you can't prove that you were operating in a proper perspective with this patient. And the licensing board can start an investigation, the police can start an investigation, and sometimes these investigations start concluding the wrong conclusions, especially when the patient's saying, oh, I get as much as I want from this guy, and especially when the patient is being manipulative.
Great. Ken, time is over. Maybe I will ask you more questions in one of the forthcoming weeks. So thank you very much for coming to our studios. Really, we appreciate.
Thank you.
Thank you.